Aspirants of European Diploma in Intensive Care. Here I am Dr. Sunil Garg to guide you in the journey. In this video, we will go through several questions spanning different organ systems. I will read the questions for you. If you still need more time to understand questions, you can pause the video to read question yourself. You can take your own time to practice and understand. Subsequent to the question, you will find the correct answer for that question and its explanation. For questions number 11, there will not be any answer and explanation available. This is a new feature of my video and this question is designed in a different manner and unique way. You can write its answer and explanation in the comment section box to have a wonderful discussion. For any more explanation, please write down in the comment section so I can respond there. I wish you a great journey ahead. The primary aim of initiating this is to introduce you to a variety of questions the way it appears in exam with different organ systems. Questions are based on basic knowledge and concepts and easy to understand, and their difficulty level is moderate. These questions are designed to test knowledge and understanding of critical care. The explanation provides the rationale behind the correct answer, helping to reinforce learning and understanding of key concepts in critical care medicine. Now you can see questions and their choices. Question number 1. A 55-year-old male with severe traumatic brain injury is being evaluated for brain death. Which of the following statement is most appropriate? Option A. The diagnosis of brain death is based on clinical signs, known cause, and the proof of irreversibility. Option B. Patient must be observed for at least 12 hours prior to initiating brain death examination. Option C. Brain death examination must be initiated after obtaining consent. Option D. If it is unclear whether observed limb movements are spinally mediated, the determination of brain death should not be continued. And option E. The presence of diabetes insipidus is a prerequisite for brain death. The correct answer is option A. The diagnosis of brain death is based on clinical signs, known cause, and the proof of irreversibility. Question number 2. With regards to use of nebulized antibiotics, which of the following statement is not true? Option A. Aerosolized delivery of prodrug of colistin to critically ill patient achieve high active drug levels in epithelial lining fluid of the lungs. Option B. Nebulized antibiotics are not suggested for the treatment of respiratory infection caused by the crab infection. Option C. Nebulized antibiotics are not suggested for the treatment of respiratory infections caused by the DTR Pseudomonas aeruginosa. And option D. Nebulized antibiotics achieve sufficient penetration and or distribution throughout lung tissue to exert significant bactericidal activity. And option E. There are concerns for the respiratory complications such as bronchoconstriction with use of aerosolized antibiotics. The correct answer is option D. Nebulized antibiotics achieve sufficient penetration and or distribution throughout lung tissue to exert significant bactericidal activity. Question number 3. A 21-year-old female presented to hospital after she met with an accident while driving. On presentation, she was conscious, heart rate 116 per minute regular, blood pressure 96 by 70 mm of mercury. Her major injuries were bilateral pelvic bone fracture, bilateral iliac bone was broken into multiple fragments and they were coming out of the anterior abdominal wall on both sides. She was protecting her airway and cervical collar was plied. Her saturation was normal on room air, but her blood pressure was continuously decreasing along with fall in sensorium with minimal urine output. CT brain was normal. On arterial blood gas analysis, significant findings were pH 7.30 and lactate 3.5 millicoulant, while oxygenation was normal. In terms of initial resuscitation and management, which of the following is least appropriate? Option A, injection tranexamic acid. Option B, permissive hypotension. Option C, blood and plasma. Option D, IV fluids. And option E, damage control surgery. Correct answer is option D, intravenous fluids. Question number 4. A 25-year-old male presented with around 10 days history of headache, intermittent fever, dizziness and difficulty in walking. His MRI brain revealed single right cerebellar abscess and right transverse and sigmoid sinus thrombosis. Which of the following is most likely focus? Option A, autogenic. Option B, frontal or ethmoid sinus. Option C, cardiac. Option D, odontogenic. And option E, hematogenous. The correct answer is option A, autogenic. Question number 5. A 27-year-old man brought to hospital after an accident. On arrival, his heart rate was 110 per minute regular, blood pressure 90 by 60 mm of mercury, respiratory rate 23 per minute, temperature normal, GCS score 3, and pupils were 3 mm equal and fixed. He was intubated and ventilated. CT scan brain revealed large left subdural hematoma with midline shift of 7 mm. There were no other injuries to the patient. Which of the following is most appropriate statement? Option A. Patient needs immediate surgical intervention. Option B. Expectant management should be given. Option C. His organs can be used for transplantation. Option D. No surgical intervention is required in view of GCS3. And option E. No surgical intervention required in view of fixed pupils. The correct answer is option A. Patient needs immediate surgical intervention. Question number 6. A 63-year-old male presented to hospital with pain abdomen. On initial arrival, he was tachycardic and hypotensive, and CT abdomen revealed the presence of perforated sigmoid. He was initiated on broad-spectrum antibiotic which consisted of piperacillin tazobactam and metronidazole along with initial resuscitation. Though his initial blood culture turned out to be negative, the sample sent from abdomen after surgery revealed the presence of E. coli which was resistant to meropenem and positive for New Delhi metallobetalactamase. Based on this information, which of the following is appropriate intervention? Option A. Continue piperacillin tazobactam and metronidazole. Option B. Continue piperacillin tazobactam and stop metronidazole. Option C. Stop piperacillin tazobactam and metronidazole and initiate meropenem extended infusion. Option D. Stop piperacillin tazobactam and metronidazole and initiate ceftazidime avibactam. And option E. Stop piperacillin tazobactam and metronidazole and initiate ceftazidime avibactam and aztreonam. The correct answer is option E. Stop piperacillin tazobactam and metronidazole and initiate ceftazidime avibactam and aztreonam. Question number 7. A 56-year-old man presented with severe abdominal pain for last few hours along with bleeding per rectum. On examination, he was tachycardic and hypotensive. Abdominal examination was evident for severe tenderness. He was a known case of diabetes and hypertension and was taking regular metformin, gliclazide and ramipril. Investigations revealed neutropenic leukocytosis and deranged renal function. Arterial blood gas showed metabolic acidosis and raised lactate. He was advised contrast CT scan abdomen, IV fluid resuscitation initiated along with a broad-spectrum antibiotic. To reduce the risk of contrast-induced nephropathy in this patient or in this condition, which of the following is most appropriate intervention? Option A. Intravenous hydration with saline. Option B. Acetylcysteine. Option C. Postpone CT scan. Option D, consider non-contrast CT scan abdomen. And option E, stop ramipril and metformin. The correct answer is option A, intravenous hydration with saline. Question number 8. A patient with advanced metastatic cancer is admitted to intensive care unit with respiratory failure. After a family meeting, the decision is made to limit invasive intervention and pursue comfort care. Which of the following is the most ethically appropriate next step? Option A, discontinue mechanical ventilation immediately without explanation. Option B, continue all current interventions while discussing comfort care options with the family. Option C, begin palliative sedation and withdraw life-sustaining treatment after full discussion with the patient if conscious and the family. Option D, administer a high dose of opioids to hasten the patient death. And option E, begin palliative sedation while continuing mechanical ventilation without further escalating therapy. The correct answer is option C, begin palliative sedation and withdraw life-sustaining treatment after full discussion with the patient if conscious and the family. Question number 9. During a pandemic with limited ICU resources, you have one ICU bed available and two critically ill patients, a 45-year-old with a potentially reversible illness and a 75-year-old with a severe comorbidity. What is the most ethically justifiable approach to ICU admission? Option A, admit the 75-year-old due to respect for elderly patient. Option B, admit the 45-year-old based on the principle of utilitarianism considering potential for long-term survival. Option C, use a first come, first serve approach to avoid discrimination. Option D, admit both patients by exceeding ICU capacity, ensuring equal access to care. And option E, admit patient who has paying capacity. Correct answer is option B, admit the 45-year-old based on the principle of utilitarianism considering potential for long-term survival. Question number 10. A 62-year-old male, a known case of lung malignancy, visited outpatient clinic for follow-up. On investigations, his serum sodium value was 125 millicoulant per liter, which decreased from 131 millicoulant per liter during his last month visit. Upon evaluation, SIADH was established as the underlying cause of hyponatremia and he was advised to restrict fluid intake as part of management strategy. All the following are predictors of likely failure of fluid restriction in hyponatremia management except option A, urinary osmolarity more than 500 milliosmol per kg of water. Option B, 24-hour urinary volume less than 500 ml per day. Option C, restriction of protein intake. Option D, sum of urine sodium and potassium concentration exceed the serum sodium concentration. And option E, restrict daily fluid intake to 500 ml less than the daily urinary volume. The correct answer is option E, restrict daily fluid intake to 500 ml less than the daily urinary volume. Thanks for watching this video. If you have any feedback, suggestions or comments, please write down in the comment section. Once again, thanks for watching this video. See you in next video on some interesting topics and questions. Till then, bye and take care.